Hello, my name is Paul Moback and I'm the Chief Executive Officer of Dudley CCG, and I want to tell you why integration is so important to us. For me, it's really about two things. It's about the people we serve, and it's about the people providing services to them. One of the things that's both unique and fantastic about the NHS is the way in which the public are registered with their GP, and it's through registering with their GP that they're able to access healthcare. One of the things that we want to try and do is support people to be as independent as possible and as healthy as possible in managing their own conditions and their own lives. The driving principle of integration is to deliver more responsive, joined-up health and care services that result in better outcomes for the people of Dudley. Integration enables the staff delivering care to work together more effectively and efficiently to ensure that patients get the care they need, when they need it, and where they need it. Integration is an enabler for staff and will empower them to work together across organisational boundaries for the good of patients. It's about teams working together without walls. Integration will also provide opportunities for patients and carers to have more say in the way their care is planned, developed and delivered. By more effectively integrating health, social care and voluntary sector services, we can reduce the number of people who are inappropriately admitted into hospital, reduce the number of people who are inappropriately admitted to care homes, and enable people to live independent lives in their own communities. Our model of care starts with the individual person. In Dudley, our aim is to deliver person-centred care through integrated services focused on the registered population of our GP practices. The public register with their GP and look to them as their first point of contact for many health and wellbeing services. GPs, together with their patients, are at the heart of this model of care. The GP has overall lead responsibility for the coordination of a person's care and is therefore the core member of the teams that we are putting together. We are restructuring other services so they are organised around the practice as part of this team and therefore are able to take a shared responsibility in the care of the same shared group of registered people. This includes link workers from mental health, social services and the voluntary sector, as well as local community and district nurses, and if needed, the practice-based pharmacists and other support services such as physio or OT. This group of services coming together within the practice form what we call our practice-based multidisciplinary teams. The integration of health, social care and the voluntary sector in this way will be the major catalyst in the way care in Dudley is planned, organised and delivered. This approach enables these teams to genuinely work together to deliver personalised care for each individual person in partnership with them in order to best meet their health and social care needs. Within this team, the main coordinator of the person's care may change depending on their needs. However, the GP always retains overall responsibility for their care.
Integration for us is the bringing together of that multidisciplinary team, finding out information from the patient from all different angles. It's not just about their physical needs, but their social needs and their mental health needs. So multidisciplinary team is the GP, who is the main coordinator of the multidisciplinary team. Then there's social workers, who look at the general social aspect of the patient. There's the community link worker who looks at all the different voluntary agents that are out there who might be able to give extra help to individual patients. There's the mental health worker who looks after patients' general mental health. Then we've got the all-important district nurse team and the virtual ward team who have very much a hands-on impact to patients. And then as well, we've got also the community pharmacists that might be able to give us extra information regarding medication and the impact that has on a patient. He's a gentleman who's got lots of physical problems as well as social problems, and I believe virtual ward are involved.
Yeah, we're seeing him monthly, yeah.
Good.
Because he went into child house for a few days but didn't like it, so he's gone home.
Right.
And they've increased his RNS to 20 micrograms weekly.
So this MDT approach is extremely useful for our top 2% of patients. So these are 2% who are likely to have an admission to hospital. They've been identified using the risk stratification tool. Not only have we used this, we've also used patients who are under our virtual ward team and patients who we see on a daily basis who we can see that their needs aren't just physical, but who need a multidisciplinary team approach.
This approach to providing integrated care with every person registered with our practice doesn't just deliver personalised care, it also recognises that we are part of a community, and the MDT is working with a community of people registered with that practice. We not only take responsibility for delivering better outcomes for the individual, we also take a shared responsibility for delivering better outcomes for our community.
The role of the social worker at the MDT meeting is looking at a different perspective to the medical model of keeping somebody in their own home for as long as possible with a quality of life as good as possible. So we can look at it from not only the person needing personal care assistance, but looking at a wider issue, carer support, if there's any safeguarding issue, really looking outside the box. We can bring our own cases, so again that benefits myself and my team because we bring in people that perhaps GPs weren't aware about the difficulties, and so it's highlighting to them somebody that's been on their kind of caseload but they hadn't thought there was a problem. So it's a two-way street. We need to kind of work together and building that relationship. So say if I phoned like Jan, the district nurse, and said, look, I've got this situation, what do you think? That we work together. Or if Wendy from the Integrated Plus service, we've got somebody for you, what would you think about it? It just kind of, that working together, that working relationship has to work for that person then, because we know each other, we know our different roles. We know how we can come together to work together.
The benefit for the patient will be being discussed at the MDT meeting, that any complex needs or any issues that we feel we can address can be discussed to give them a clear pathway to their care through a single voice. It's lovely to have the involvement of everybody within that MDT. The current way of working is that if a patient has multiple comorbidities, illnesses, there will be several nurses that will be required to visit that patient within 24 hours. The new way of working will hopefully address that only one nurse will visit that patient to address all their illnesses, whether it be once a day, twice a day, but that one person will be able to do all issues that arise with that patient.
Well, if there was any other problems, anything wrong with something else in your body, if the one person that came to treat you leg ulcers could treat you for that at the same time, it'd be much more convenient. I think it'd be much more economical as well, because they would come and do the lot at one go, one visit. Obviously, I'd rather have Jan to come every time, but I mean, obviously she's team leader and it wouldn't be convenient, but they're all as good as the other. Yeah, I've got no qualms with any of them. They're all very good.
One of the important features of our model is the introduction of voluntary sector link workers, who connect the work of the MDT through to the voluntary sector and help individuals and communities access the wider voluntary sector services that are available.
Within the multidisciplinary team, our role is to identify patients that we may be able to support who are possibly socially isolated, suffer mild depression, learning difficulties, who perhaps are not so reliant on need of medical intervention, but it's more of a social intervention. There are over 800 voluntary and community sector organisations within the Dudley borough, so there's a lot out there to support people. At 3 villages, the multidisciplinary team, Dr Taparo referred this patient to me. It was highlighted that he was socially isolated. So I thought that I might be able to meet up with him and see how I might be able to support him. I went to meet the patient at his own home, and we identified a number of ways in which I might be able to support him. and we discussed his interest, his activity, things that he likes to do, things that he used to like, and ways that he might be able to get back connected back into the community.
Before I met Wendy and she came to me about this scheme, because of this disability, that unfortunately I have had to leave work. So I'd worked at the same place for like 25 years, but I've had to leave there now. And having no family at all, I am virtually housebound with this disability now. And then when Wendy came and told me about this scheme, it's opened up a lot of more possibilities for me, like these IT classes, also men's social groups that I can go to mix with other people. It has also encouraged me to sign up with the mobility scooters at the Hill, so that means I can do my shopping in comfort. Also day trips, seaside trips. I'm signing up with the extended IT course in January, which will be a massive help because I can have my shopping online, which I'm finding very, very difficult to shop at the moment with this, the way I am with this disability. And it's just made a massive difference. And I say Wendy's found out a load of stuff for me. So she's done really well and it's just been a really big help.
To ensure resilience, continuity of service, shared learning and best practice, we coordinate the various parts of these teams, such as district nurses and virtual ward case managers, on a wider geographical basis. These teams work together across localities, of which we have 5 in the CCG. We have appointed 5 lead GPs to coordinate this work across each of these localities.
Each locality has its own distinctive flavour. Dudley and Netherton has quite a high black and minority ethnic population and is a poorer area traditionally, sadly. Other areas have different social needs and social capacity, so family dynamics may be different and family strength, resilience may be different in different areas. Because we're focused on a smaller population of around about 60,000 individuals, we're able to tailor those services to the individual communities within that group. So one housing estate may have particular high needs, and because of our local focus, we'll be able to put the services where they're needed. So being a locality lead involves getting the various players in the multidisciplinary team across our entire locality working together. In Dudley Netherton, that's 11 practices. In other areas it might be fewer, but still there's a bunch of practices that have to learn to work together better. As GPs we have very specific lists, but a mental health nurse might cover multiple practices. They will have a different contribution, therefore they'll see and experience different elements that another surgery may be doing well that they can bring to my surgery or they can take from our place elsewhere. And I think there'll be much better cross-fertilisation in the future as we get to know each other and really work together for the benefit of the system and especially the patients.
The design of the system starts with the person who is registered with the practice, which is part of the locality, and our 5 localities come together to form the system as a whole. This creates a borough-wide network of integrated services, and this helps us to establish shared responsibility and shared outcomes at every level in the system of care. So I hope you can see by the way in which we're organising services here in Dudley that we're really trying to make a difference, and we want you to work with us to really make a difference to your own life as well as a difference to the lives in your community.